My name is Toluwa Lashea Ajayi. I go by Lashea Ajayi. I'm a pediatrician, as you said. I work at a couple of different institutions here in San Diego. I work within Rady Children's Hospital in San Diego, where I do home-based palliative care. I also am a community pediatrician. I do newborn nursery and a healthcare qualified health center, where I love it. And I also do adult inpatient palliative care within the Scripps Health System. And I teach fellows within UCSD. And I'm also a clinical researcher within Scripps Research. Pediatrics was definitely a calling. So my mom will tell you that so when I immigrated to the United States, I went through a public health screening that was not great. And that was in the late 80s. And apparently it was terrible. And my mom said at that time that I wanted to be a pediatrician because I wanted all kids to feel safe when they went to go to the doctor. And so that never really changed. That never really wavered from why I wanted to be a doctor, and particularly kids. And I just have always gravitated towards children. I didn't always know that it was palliative medicine that I wanted to do. I actually thought it was going to be infectious disease or pain medicine. I fell in love with patients with sickle cell disease, actually, and the understanding their total body pain and wanting to help address it. And that has stayed with me. And so I had great mentors like Emily Regal and Jenny Lineberger, and actually Kathy Davis, who's a social worker, still palliative care social worker at the University of Kansas. And they really saw something in me that I didn't recognize. And they saw how I interact with patients and families. And they said that I would really like something called palliative medicine, that I didn't know what it was. And so I did rotations with Emily, who was med peds, and I did some rotations with her on the adult side. And then I got to know Jenny Lineberger, who was leading the pediatric palliative care program at UMKC. And, she was absolutely right. It was being in those vulnerable spaces with the families when they didn't know what was going on with their children and that level of uncertainty. And I wanted to be that person with them and to hold that sacred space with them, in addition to that pain management and that, honestly, that total body suffering. I wanted to understand it and make it better. And it was a natural fit for me.